Wasn't Steve great? Didn't you feel like you were at church being preached to? Yes, we're on a mission. We're on a mission from God almost. It's fun. Okay, now you have batteries included. This is a health conference, so can you please, health part of the conference, so breathe deeply, stretch. Come on, all of you, stretch, yes. I want to see your batteries included. I'm just checking who has their battery. Great, that's the most healthy thing you'll do all day. All right, in about 10 minutes, 9 minutes, I'm going to tell you about the trends in healthcare that have been going on. I've been working with Steve and his colleagues at Startup Health for many, many years now. And I'm going to tell you a little bit about how we started at Health 2.0 as a conference and also as a movement, just with a few companies back in 2007. In fact, Steve was there with his company, Organized Wisdom, back then. We had little doctors' networks like Sermo, with just a few thousand doctors, Patients Like Me, those types of companies. We've had big changes. In the US, we've had money from the Recovery Act for medical records. We had the Obamacare Act. And then we've got big players coming into the market now like Samsung and Apple and Google providing a platform for technology and for data. So we have a number of big changes in healthcare, and we have a lot more companies. We count about 4,000 companies across the world in this space of health technology. So what the hell is Health 2.0? Well, started back then with the concept of Web 2.0, and you may remember Tim O'Reilly and his organization talking about Web 2.0. That's things like easy-to-use software that gave democratized access to information, allow people to publish as well as receive information, all these different types of terms. When that was going on, the healthcare business has really been stuck. Healthcare business has been stuck in the world of enterprise technology, and it still is. And it's a big challenge that we have to face. There's a new term I like, which is called SMAC. Who's heard this term? Anybody heard this term, SMAC? It's not my term. I didn't invent it. SMAC, kind of clever. It's about the technologies that we're thinking about: social, mobile, analytics, and cloud. I like the concept of SMAC. It's the idea of this is new stuff. It's not enterprise software. This is stuff that's living in the cloud that we can all use. And we use this every day. We need to get this stuff into healthcare. But for healthcare, we need a little bit more than just SMAC. We need one more thing. We need empathy, and we need kindness. So I like calling it SMAC Health, as in SMAC. All right. What are the technologies then actually doing? What do we define as Health 2.0? Well, my colleague Indu Sabaya, my co-founder and chairman, and the much better-looking person at Health 2.0, she came up with this great definition a while back. You were looking for technologies in healthcare that are adaptable, that play well with others, a bit like Steve and his healthcare transformers. These are companies showing their APIs and making data move freely available. We want to focus on the user experience. Any of you who are healthcare professionals know that the user experience of the current generation of electronic medical records and most patient software completely sucks. We need to change that. And we also want to get data everywhere to really inform and drive decisions. Very, very important to get data involved. Okay. Back in 2007, we actually said, well, you know, this stuff, living in the cloud, this Web 2.0 in healthcare, it might work, and it might actually change healthcare. We forecast, you know, at a guess, there would be 4 stages of Health 2.0. First stage is user-generated healthcare, moving to consumers connect to providers, and then maybe we would get delivery reform from these new partnerships, and maybe we get data to actually change healthcare. I'm going to tell you that these stages now are all well underway. This is not future, this is happening. And let me show you a little bit about the user-generated healthcare. This is Patients Like Me. This is one person who's put in a lot of detailed content about health in Patients Like Me. These were like wacky outsiders back in 2006, 2007. Now, Patients Like Me, data from that service is included in Walgreens, the biggest drug retailer in the world, as a side effect. So you're really seeing the integration of Patients Like Me outsiders into the main system. This is data from Twitter. The CIO of Boston Children's Hospital, John Brownstein, has been tracking Twitter data, what people think about the hospital. You can see some people complaining about the hospitals there. He's actually shown that this data is actually as good, if not better, than US government surveys about hospital quality. So we're getting from the crowd. And then you get odd companies like, back in the day, MedHelp, a small company that had Q&As between doctors and patients back in 2007, 2008, now acquired by Physicians Interactive, itself owned by Merck, and working with GE, has built out a whole platform that consumers can manage their own health on. So user-generated content is a big part of this, and it's really going on. All right, the second stage then was consumers connecting to providers. In 2008, the biggest integrated system in America, Kaiser Permanente, allowed everyone to email their doctor. How many people here have ever emailed their doctor? Not many of you, right? So it's taking a long time for this to come in the transition. Who else in your life can't email? You can email everyone, right? I'm going to tell you that this is underway again. You're now seeing players like American Well and others who are doing virtual online visits. I'll talk a bit more about this a little later. And even beyond that, you're now using the new technology, the iOS and Android, companies like Vida, both for patients who are sick and patients who are healthy but trying to lose weight, but also patients who are very sick, who are being discharged from hospital with cancer or with heart disease. They're now able to sort of list their medications, use HealthKit to get information from devices into the system, and then also get real live coaching, both in kind of Facebook-like feed from coaches, from multiple coaches, and also live video chat and support from coaches. It's really paying off, really helping patients recover. The third stage, and now we're getting really quite controversial, because the healthcare system has been basically the same for about 8,000 years. There was a doctor, you went to visit the doctor told you what to do, you left, no one knew what happened afterwards. That was the healthcare system, and now we're going to reform how that delivery happens. This is a company called CareSync. They are taking data from multiple doctors and hospitals. They're extracting that data in both an electronic and a manual process. And the way they're doing that is they're actually working with big electronic medical record vendors like Allscripts. And they're now telling people about the stories of patients. For instance, Medicare patients above 65 in the US, have 7 different doctors on average, take 13 different drugs. Nobody knows what's going on in those other doctors' offices. These people at CareSync's bringing that data together. Another company like PocketDoc is exposing the APIs of those hospitals and doctors and allowing people to build services like shopping, pricing, provider selection on top of that. And then you have really big players. United Health Group is the biggest insurance company in America. It's put together a whole rash of other players. And it's now starting to deliver care in whole different ways. CVS, the second biggest drugstore, pharmacy chain in America, has put together 3 or 4 players in the online virtual visits. And now a drugstore, a retailer, is providing office visits and virtual online visits. That's really shaking up how healthcare has been delivered. So that's the third piece. The fourth piece, and this is still is just starting to happen now, is that we're starting to extract data. This is a screenshot from a company called, here we go, company called Yazdi, and every one of these boxes is a piece of activity in the clinical workflow of an operating room for knee surgery. And they basically were able to use big data to extract from Epic Systems, the dominant EMR vendor in America, what happened with all these different patients, and actually ended up with the fact that the one minor change of when you gave a drug radically improved the outcomes. And they were able to change this around with this workflow using big data and put it back into the Epic system to improve outcomes. A company like Validic is taking all the wearable data and bringing that seamlessly into electronic medical records and populations. So you're seeing that kind of change, that connection as well. You'll hear from IBM in a second, so I won't use this slide. But now with Apple HealthKit, you have people like University of California, San Francisco, allowing people to basically run their own clinical trials. This is a trial for lesbian and gay people in San Francisco looking at their own health. So I hope I've convinced you that these changes are underway and they're already going. Okay, we all need to be doing virtual visits. We all need to be emailing our doctors. But these stages are now happening. What's coming next? I'm going to skip this slide. What's coming next? We're actually changing the game about how we're going to think about who is delivering care, who's receiving care, and how it all works. We're going to inform, connect, diagnose, and treat. You notice I'm not saying who's informing, or who's diagnosing, or who's connecting, or who's doing the treatment. Let me give you a couple examples. In the spheres of online coaching, doctor search, crowdsourced information, even accessing genomic information, we have a number of startups, and these are just a few examples, who are really changing the game about how people are going to be gathering information, delivering information, whether they be patients or doctors. In the field of virtual visits and connecting, I mentioned American Well, Teladoc, Doctor on Demand. This is my son, Aero. He almost has a Finnish name. That's his arse. He had a terrible diaper rash. What I did was I grabbed my iPad. I went online to American Well's site, provided by Anthem. I took a photo. I answered a few questions. I uploaded that photo. 3 minutes later, a doctor comes on in live video, comes to me and says, yes, go to Walgreens because I've already sent us a prescription for stuff that will clear up his arse rash. So in that we have clinical diagnosis. We have information about the condition. We have photos. We're integrating live video. We're integrating payment, clinical advice, and prescription in one simple app. All this stuff coming together. All right. We're going to get that last inch. Not only are we just doing video, we're going to attach devices like the new Taito or the Med Wand, just both of them very newly out. We're going to attach those to wireless systems, and you can actually stick this in your mouth, in your throat, in your ear, start diagnosing yourself. So we're getting that last inch as well. Really going to be changing how we think about connecting. Last two things. Diagnosis. It's going to become cheaper and faster. It's going to be much smarter, and it's going to be more decentralized. I want to give you a couple of examples. I only have a couple of seconds left. I'm going over time a little bit. It's Cloud DX. You can actually, this is up for the Tricorder X Prize. You can actually cough into the Cloud DX phone, and it will actually diagnose you from your cough. Smart Vision Labs just had a study come out yesterday, which showed that their eye exam was more effective, as effective as one of those big eye exam systems. Can be taken to the third world with just a simple phone, simple attachment, can diagnose eye conditions. And this is a great one. Mobile ADT, a company out of Israel, is allowing nurses, like the one on the left, to do cervical scans. In the third world, very, very hard to do cervical scans, mostly on paper, allowing that to happen using just a simple attachment to an Android phone and allowing them to charge on the phone with payment, putting that together, making that nurse not only doing diagnosis, but also making her a real entrepreneur. And then finally, treatment. I don't think we're going to be doing, surgery on the kitchen table to ourselves, but we're certainly having companies like PhysIQ, which are tracking with algorithms for post-discharge patients, whether they should perhaps change their own treatment pattern, change their drugs. And then on the far right, this is Ellie. Ellie is a robot that lives in a box, but she does a great job of psychotherapy, and we have far more automated treatment. So the world is really changing rapidly in those four spheres. Okay, I'm out of time. I'm going to leave you a couple of things. Announced yesterday, working with IFC, Health 2.0 is doing the Tech Emerge program. Go to techemerge.org. For anybody who's a startup, founded partly with our friends here at Finland, we're going to be moving on and having taking these startups to India, to hospitals in India initially in the next program, and then hopefully to the rest of the developing world. So really bringing new technologies to places across the developing world, an initiative of the IFC and the World Bank. So please go check that one out. And then just to come meet us at Health 2.0, we have a conference in WinterTech in San Francisco in January the 13th. If you're a developer or designer, we have our Health Experience Refactor conference in Boston on April the 5th. Please come join us in Europe, in Barcelona. Use the Slush 15 code for 25% off. And finally, it's going to be our 10th anniversary of celebrating this amazing change in healthcare in Santa Clara, California, and in San Francisco in 2016. I have gone over my time. I want to thank you for your attention. And I think, with folks like you, like Steve, and what you're going to hear about in a minute, we're really going to change healthcare. Thanks so much.